Medicare Medigap Plan N is one of the standardized Medigap plans available to Medicare beneficiaries. It is designed to help fill the gaps in coverage left by original Medicare. Here's what you need to know about Plan N. First, Medigap Plan N covers many of the out-of-pocket expenses that Medicare Parts A and B don't fully cover. This includes deductibles, co-payments, and co-insurance for hospital stays, doctor visits, and other medical services. Second, Plan N offers some cost-sharing features. You may have a copayment of up to $20 for doctor visits and up to $50 for emergency room visits. However, these cost-sharing amounts can help keep your monthly premium lower compared to some other Medigap plans. Third, Medigap Plan N doesn't cover the Medicare Part B excess charges. These charges can occur if your healthcare provider charges more than what Medicare approves for a specific service. It's important to consider this if you frequently see doctors who don't accept Medicare assignment. Plan N allows you to see any healthcare provider nationwide who accepts Medicare patients. There are no network restrictions, giving you flexibility in choosing your doctors and specialists. Medigap Plan N is just one of many options available to Medicare beneficiaries. Carefully reviewing your healthcare needs and comparing different Medigap plans is crucial to finding the one that best suits your individual situation. We hope this overview has helped you understand Medicare Medigap Plan N. Let's explore another vital aspect within the realm of Medicare and Medigap.